Welcome to today's video. We'll be going through a video tutorial on how to use a TENS machine properly. As many of you will probably already know, a TENS machine is used to help with pain relief to varying levels of success. So in this tutorial, we'll try and keep it as objective and unbiased as possible. I'm not here to try and plug in any product or have any affiliate links to make money. Really here to try and help you use your TENS machine to its fullest potential. So in this video, we'll be going through some practical tips on how to use a TENS machine properly, including settings, location, as well as a bit of science behind how it works.
What is the TENS unit? TENS stands for Transcutaneous Electric Nerve Stimulation, and most units will look like this. Typically, your TENS unit comes with buttons that help modify your treatment settings and about 1 to 2 attachment points where you can connect to gel pads. These gel pads latch onto the skin to help deliver electric impulses as a form of electrotherapy to aid pain and aches. These pads can be placed around multiple areas in the body to help temporarily ease muscular issues like muscular tightness or joint pain. However, there are areas on the body where you should avoid placing the pads on, and we'll talk about this later on. The main reason to use your TENS machine is for pain relief. Pain can be classified as acute or chronic. TENS machines help provide relief for both acute pain like muscular spasms or sprains, or chronic pain like arthritic or nerve pain. The key word I use is pain relief.
Unless you're already going to get better, a TENS machine does not cure the root cause of your pain.
If you're looking for a quick and temporary form of pain management, the TENS machine can be effective for some, but not everybody. One of the best features of the TENS machine is that it is portable and usually rechargeable, meaning they can bring it wherever you need it, like on a holiday or at work, without having to bring your own masseur. How does TENS machines work? A TENS machine works on a theory called the pain gate theory. When exposed to something sufficiently uncomfortable, like an injury or a punch, the body sends specific signals to the brain to let us know that we are in pain. When this happens, we say that the pain gate is open. A TENS machine sends electric impulse to the brain via gel pads on the skin in order to close these pain gates. Especially when you set your TENS machine on a high frequency setting, these electric impulses begin to activate your body's sensory nerves. These sensory signals begin to compete against your pain signals for your brain's attention. In theory, this would begin to override the painful sensations that you're experiencing. The most simple way to describe this sensation would be the loudest wheel gets the oil. The louder the TENS machine can activate your sensory nerves, the quieter your pain signals become. A real-world example would be rubbing your elbow that you've just bumped into the doorway. You are essentially distracting away your pain. How to use a TENS machine? This is probably going to be the most clicked section on this video because this is what most people want to know. You're in pain, you want to get rid of it. How do I use my damn TENS machine? Well, here we go. When using TENS machine, there are some key factors to consider, including 1. Settings, 2. Pad placement, and 3. Duration of treatment. We'll go over your settings and pad placement very shortly, but as for duration, this will vary from person to person. Studies have the subjects use the TENS machine anywhere from 15 to 60 minutes effectively. It all depends on your specific needs and requirements. It might be worthwhile just trying to experiment to see how long you need the TENS machine for to get an adequate amount of pain relief. Setting up your TENS unit. When setting up your TENS unit, it's usually quite straightforward. Typically, you've got your TENS machine and then you have a pack of gel pads that come separately. Each pair of gel pads will connect into a lead ending in a pin connector. This pin connector will fit into your TENS unit, and together a pair of gel pads are called a channel. Once you've done this, I'll go through each single step in setting up your TENS unit. So do you use 1 or 2 channels? As I mentioned earlier, each channel has a pair of gel pads that both need to go onto the skin for treatment. My recommendation is that 1 channel is used for smaller or more specific regions like your wrists or hands, whereas 2 channels is better for larger areas like your lower back and thigh. It's also important to understand that not all machines carry 2 channels, although this is mostly the case, so please take this into consideration when purchasing your TENS machine. So where do you place your gel pads or channels? The placement of your gel pads are generally pretty straightforward. According to a TENS guide written by Tim Watson, he suggests placing the electrodes on either side of the painful area, essentially surrounding the area that you saw. For instance, say for example, tennis elbow, a very specific and small area of pain, only 2 electrodes or 1 channel is needed. The treatment area will be located around the outer elbow, which is a common location for tennis elbow. Treatment is then delivered between these 2 electric pads. For larger areas of discomfort, say for example lower back pain, I recommend using 2 pairs of gel pads or 2 channels. The order of electrode placement is pretty important. A crossing effect should be used where each pair of electrodes are placed diagonally from each other. That ensures that the treatment is focused on the area in the middle rather than the sides. How to configure your TENS machine. Configuring the device can be pretty tricky as everyone will respond pretty differently to the exact same settings. Different injuries or causes of pain can also benefit from specific settings. Selecting your frequency settings. Frequency measures how many electric pulses are delivered over a period of time. For most TENS units, it's measured in Hertz, so 1 Hertz would measure to be about 1 pulse per second. Every machine is different, but here's how I adjust my TENS machine for frequency. There are generally 2 ranges of frequencies that we want to target. Higher frequency ranges, which depending on what studies you're looking at, vary between 90 to 130 Hertz, whilst the second category is lower range frequency between 2 to 5 Hertz. Your high frequency ranges are more suited towards acute pain relief, where they are able to provide more immediate but shorter periods of pain management, whereas lower frequency ranges yield a more prolonged but slower effect. How to select your pulse width. The pulse width can also be set before your treatment. Typically this is measured in microseconds and accounts for the duration of each pulse. I personally haven't found much research in investigating the effects of pulse width, and I've tried testing out different pulse width treatments and haven't noticed any significant differences. Perhaps lower pulse width feels a bit less intense, but nothing very noticeable at all. Setting your intensity. The intensity of treatment can be adjusted after the treatment has started. Measured in milliamps, the intensity indicates the strength of the treatment. The higher, the stronger the treatment. It's important that you select a high enough setting where you feel the pulses, but not too high where it becomes uncomfortable. It can be a very subjective setting and different people will feel a different sensation even at the same intensity. It is normal to see your muscles twitching, but remember not to push it past the point of discomfort or pain. Benefits of TENS. From my point of view, there are various benefits for using a TENS machine. The first benefit is that TENS can be used to assist with pain relief for a variety of musculoskeletal issues, including strains, sprains, arthritis, neuropathies, and even menstrual pain. TENS machines provide symptomatic relief by inhibiting pain signals, but don't cure the problem itself. Benefit number 2 is that it is a portable and lightweight device that you can take on the go, during work trips, gyms, or even when you're traveling. One charge generally lasts quite a while, so you won't need to constantly plug it into a charger. The third benefit is that the TENS machine is generally quite cheap. You'll find these devices going anywhere between $40 to $200 depending on the brands and features. For my international audience watching, this is about 27 to 135 American dollars. So for most people, you don't really need to break the bank for something like this. The fourth benefit is that TENS machines are generally considered a non-medicated form of pain relief. This means that you're not taking any drugs or medications. By not taking medications, you reduce the risk of being exposed to harmful chemicals and drug-related side effects, although we will talk about the potential side effects of TENS machine later on in this video. The fifth benefit is that you are in charge of your treatment. You know your pain the best, so it only makes sense that you tailor the treatment settings and channel location to what feels appropriate for you. Now I'm sure there are many other benefits that you can find with TENS machines, but these are just some of the key features. What are the negatives of using a TENS machine? Like most things in life, there are negatives that come with the benefits. This is no exception to the TENS machine. Based on my experiences, there are definitely a few drawbacks to using TENS machine. The first is that it isn't suitable for people with certain conditions and circumstances. Later on, we'll talk about people who should avoid or consult their GP before using the TENS machine. For example, those who have epilepsy or pacemaker may reconsider using TENS, as it can pose as an additional health risk. The second drawback is that it can be difficult to set up for some people. Considerations such as using one or two channels, find the right configuration, or position the pads correctly can be an immense challenge. The TENS might have more of a complicated setup than most people would like. The most common complaint that my patients tell me is placing the pads on tough to reach areas. Regions like your quads and your elbows are much easier to access compared to, say, your lower back and neck, especially if you have poor mobility or a bigger body. At times you might need someone to even help you position pads correctly. My third negative has less to do with the device, but the advertising and testimonials of the companies selling the TENS. Like many health products on the market, companies tend to overpromise on these devices, saying that the cure all to all your pains and aches. Unfortunately, this is mostly false advertising. Based on my experiences with using the device, my experiences with patients, and claims made by studies, the advertisements are simply misleading. Under most circumstances, TENS can help provide a short-term pain relief, but rarely the cure to your musculoskeletal problems. People who purchase TENS machines tend to think that they're able to fix all the injuries and conditions, when in reality it should be used as a non-invasive way to ease pain symptoms, similar to how massage guns and heat packs are used. Long story short, don't expect TENS machine to be the cure-all to all your aches and pains, particularly if you have a chronic condition. Precautions when using the TENS machine. Although generally quite safe, there are precautions that you should take before using the TENS machine. These include particular areas to avoid when placing TENS machine, including areas containing damaged skin such as cuts or wounds, areas with reduced sensation or numbness, swollen regions near tumors or blood clots, and areas that have been recently treated with radiotherapy or radiation. Additionally, there are specific situations where the TENS machines should not be used or should be consulted with a doctor before usage. These situations include, but not limited to, those with implanted devices like pacemakers or neurostimulators, those with cognitive or mental impairments, individuals who are unable to consent to the use of TENS machines, those who have neuropathic conditions like carpal tunnel syndrome or nerve pain. It is also recommended to consult a healthcare professional before use if you have reduced sensation or numbness in the application area, you experience severe pins and needles or tingling, your symptoms worsen after using the TENS machine, and if you're pregnant. If you are still unsure whether the TENS machine is appropriate for you, please reach out to a local doctor or physiotherapist who has experience with electrotherapy. What to do with unknown causes of pain. If there is an unknown cause of pain, please seek advice from your local doctor. While the science of TENS allows us to target the underlying mechanism of pain, it is most safely and effectively used when you have a diagnosis for your symptoms. Does TENS work? When determining whether a TENS machine actually works, I like to refer to the scientific literature. The research that I like to look at first are systematic reviews, which summarize a whole bunch of other articles of the same topic. According to 10 Cochrane reviews, which are some of the most robust systematic reviews we have out there, the authors found inconclusive evidence for TENS machines to treat a variety of conditions, including chronic pain, neuropathy, fibromyalgia, and menstrual pain. What does this mean? It suggests that there isn't enough good quality research with consistent results to draw a conclusion about whether a TENS machine actually works. However, in a recent systematic review which included over 300 randomized controlled trials and over 20,000 participants, Johnson and his team found that there was moderate evidence to suggest pain is lower during or after TENS treatment. They found that TENS machines could significantly reduce pain for a range of circumstances or conditions, including pain after surgery, neuropathic hand pain, temporomandibular pain, and labor pain. Based on this massive systematic review, there does seem to be evidence that a TENS machine might be able to meaningfully ease your pain. Such research is consistent with what I see as a physiotherapist. More often than not, a TENS machine will be able to temporarily ease my patient's pain, but they don't cure the source of the pain, which is unfortunately claimed by overpromising advertisements. Like a massage gun or foam roller, they are a tool to assist recovery, but does not fix the underlying root cause of your pain. Whether or not a TENS machine works will largely depend on your expectations. If you're looking for a quick source of pain relief, then there's a decent chance it will work. But if you're looking to cure a 10-year-old chronic lower back injury, this is a completely different story.
So that is the end of our tutorial on how to use a TENS machine properly. I want to thank you for watching this video until the very end. That way we'll continue making these educational videos on how to keep yourself injury-free and as pain-free as possible. Until then, we'll see you next time.